Hello, everyone, and welcome to CCA's Medical Minute, sponsored by Kroger Health. I'm Sherry Hughes, and this is episode 53. Yay, and it's Breast Cancer Awareness Month, and we are still talking all things pink. And today, of course, we have our wonderful oncology nurse practitioner, Jill Hunt, here with us. And also, I think what has to be CCA's first unofficial Medical Minute brand ambassador, if
Absolutely.
you will, Paula Maier.
Yeah.
How are you, Paula?
I'm doing very well.
It's so good to see you. And you were here with CCA, talking about the services and whatnot when it first got started. You're a breast cancer survivor, and we're just so glad to have you here with us
Thank you
today.
for having me.
You're looking fabulous.
I am cancer free, so
Yay.
I'm very happy and happy to be here.
Yeah. And, we were talking earlier that, we don't have a lot of pink on. It's Breast Cancer Awareness Month, but we have pink just
lipstick.
oozing from the inside.
Well, and it's all girls, so we're all pink.
I have the Erica J. Holloman pendant on me here, and I brought my little mug to represent. But you know what? We want to talk about your journey, Paula, because we want you to bring us back up to speed from when you were diagnosed to where you are now. I know Jill was here helping you along the way the whole time.
Absolutely.
So take the mic and tell us a little bit about your story, especially for those that may not be aware of it.
I was diagnosed in June of 2020 with stage 2 lobular triple negative cancer. So only 10% are triple negative, and only 10% are lobular. And lobular cancer is often called the sneaky cancer because it is often not seen, especially if you have dense breasts, on mammograms. And so during COVID, so many people were putting off having their mammograms done because it was either closed or then what followed was the fear factor of going into a doctor's office or being out in public, even when the doctor's office is reopened.
Yeah.
And so my first call was to Dr. Phil Lemmy, and second call. And we just jumped right in and said, what are we going to do about this? How are we going to fix it? It was never a question in my mind that we wouldn't end up cancer-free in the end.
And Jill, you were there with her experience there. What do you recall most about Paula's case?
Paula came in the day of her consult, and she was very much, I have cancer. Now what are you going to do to fix it?
Yes.
Because we need to be fixing it yesterday, not today, not tomorrow. I don't want to wait. I don't want to be passive. She was very much her own advocate and making sure that everything was done that needed to be done.
And Paula, advocacy is so important because you know what, you step out of fear and you step into, we've got to move on this and we've got to get things done. So, talk to us about your mindset. Was fear a factor for you?
I think for me, it was not exactly a shock because there is a strong family history of cancer in my family. So I can't say that I had that very typical reaction that you hear from other survivors or warriors where they just fell apart. And that was the moment they heard the word cancer. So I heard the word cancer, and like Jill said, I had my dukes up and I was ready to
She kicked into beast mode.
forward.
100%.
Yeah.
That's kind of my mindset and overcoming adversity anyway.
And that's what I hope all women out there get from this conversation is that, you know what, you really have to move beyond your fear and you have to advocate for yourself. A couple of things that I heard you mention, Jill, lobular breast cancer, and of course a triple negative. I know we've talked a little bit about that triple negative as well, but again, I was invasive ductal carcinoma. That's what I was, and that's one of the most common, I believe.
Right.
So what is so different about the lobular breast cancer?
It's just a different cell inside the breast. Ductal is just the most common because of all of the mammary ducts that are inside the breast tissue. And so because there's more, what's the word I'm looking for? There's just more ductal patients that are diagnosed. And so she was absolutely right. Lobular is only about 10%. But the other piece to hers, with her being triple negative, is where it makes everybody sit up and pay attention. Because when you're looking at a breast cancer diagnosis and you're looking at the actual tissue, I think we've talked about this on previous episodes where, breast tissue, it's estrogen positive, it's progesterone positive. Those are things that you expect to see in normal, healthy tissue.
Right.
And so when you have a cancer that looks completely different than what normal, healthy tissue looks like, the further away from that you get, the more risk there is.
And the more challenging it is to
treat.
Mm-hmm.
And that was the other thing. Like, we keep throwing around this term triple negative. So to break that down, triple negative is when you're looking at the 2 hormone receptors and then the HER2 expression. So
all being negative.
All of those were negative. So she was estrogen receptor negative, she was progesterone receptor negative, and her HER2 expression was negative.
Mm-hmm.
So
and Paula, you were mentioning the dense breast, which we both know all about the dense breast, but now in Ohio we have House Bill 371, which is a law, and that means women are going to be able to get that advanced screening they need if they have dense breasts or family history or whatnot. Did you understand from the onset that your breasts were considered dense?
I think I did know that I had dense breasts, but I think what women don't understand is that it's so important to know if you have dense breasts, because you need to be an advocate for yourself when getting testing done, because the way, like I said originally, mammograms often don't see lobular cancer. And for me, there was a mass there. 6 centimeters is what it was. So that's basically the size of a small lime. So people would say to me, well,
did you
feel
it?
You know it?
Right.
Everybody knew it. Everyone could, could feel it. The doctor, all of the testing. And I had a diagnostic mammogram 2 years earlier. And
so it was a fast-growing
They didn't
tumor.
see it, or they missed it. Who would know?
Yeah.
And it doesn't matter, because here I was diagnosed.
Right.
How I got there is irrelevant that moment.
I think that a lot of people throw around that, I have dense breast, and and we talk about the fact that mammograms aren't always the best with identifying anything on the mammogram when you have dense breast tissue. But what I would really like people to understand is that, so when you have normal breast tissue, you don't have dense breast tissue, and you're looking at the findings from a mammogram. It would be like looking through a glass that has water in it. You look right through it and you can see right through it clearly. But now take that glass of water and take some like murky, muddy water and cloud it up, and now try to see through that glass.
That's what they're looking for. That's how difficult it is.
That's how, if you could break it down into like layman's terms, like that's what it's like trying to read a mammogram for women who have dense breast tissue. And
I want to just add that I believe in this country, the percentage is about 40 to 45% of all women have dense breasts.
Right.
So this is like, that's almost half.
But it's not a dismal situation. Yeah. There are other means of identifying if there is a problem when mammograms are not best suited to your kind of breast tissue.
Ultrasound, breast MRI,
sonograms,
things of that nature.
Yep.
Yeah.
And that's how they found mine. And this is an interesting and fun story. I met the woman who was the woman who did my test just this last time, about 3 months ago, when I had another mammogram, because now I go every 6 months.
Yes.
MRI and then a mammogram for a couple of years. And she saw something. She felt there was an issue, and she brought me back. And the radiologist got after her. She was telling me the story that why are you bringing her back? And she said, I just have a feeling we need to do a sonogram. We need to do a biopsy. If she hadn't stood up for what she thought most clearly in her heart was a problem, it would have gone later stage, even later stage than I was. And it could have gone metastatic, which is a whole different ballgame than what I was dealing with. And I was in treatment for 2 years. And I considered those options of doing chemo and a mastectomy and radiation opportunities to put this in my rearview mirror.
Right.
Yeah, I love that. Put it in your review. We have less than a minute now, but Paula, I want to know from you, what do you think is what would you like to tell women most that you got from your experience that you would like them to know? Because we know that, 1 in 8, and it's happening every 2 minutes in this country, a woman is being diagnosed with breast cancer. What do you want to say to that woman who's about to hear those words?
Well, there's two things. One is that information is power. Never be afraid of the information, because catching breast cancer earlier means that you have many more options on treatment that may not be so severe as the issues that I had to be confronted with. I also want to say that, don't be afraid to go in for testing. And if you particularly are a Black woman, that don't be afraid and go and find places, because Black women die of breast cancer at a much higher rate, and that is unacceptable.
It is unacceptable. And you've been at it, Jill, as a nurse, oncology practitioner. What do you say to these women out there? We're talking about Breast Cancer Month all the time. We're talking about it, but what do we need to do? What's the call to action?
My call to action for women who are 40 and over, or who are younger than 40 and have a strong family history, is I want you to take care of yourself the way you take care of everybody else.
Yes.
Preach.
Because if you think about it, if there was even a rare, small chance that your child had something that you needed to watch closely, or your husband or your sister, you would be on it, and you would be on them like white on rice.
That's right.
And I feel like women are so bad about taking care of themselves. And at the end of the day, if we don't take care of ourselves, especially in these situations, we won't be here to take care of everybody else.
We can't have that.
Can I say one more thing?
Sure can.
Is that it's so important. It's awkward. People don't want to be grappling with themselves, but
I do.
it's so
I grapple with myself
go
all the
for
time.
it.
I'm just
you
all
know?
over it,
It's so important, because if you truly know your breasts, know the coloration, know the heat level, then you're going to be the first one in your monthly self-breast exams to see an issue that's not just, is there something under here that feels hard like a pea, but is there dimpling? Is there something coming out of the nipple that's not normal?
Breasts.
But if you know your breasts and you go in and you speak to a doctor and worst case scenario, they don't listen to you, stand up for yourself. Go to a different doctor.
Exactly.
Go to a different practitioner and speak up until you feel you're heard.
Thank you. Thank you so much. We could talk about this all day.
Yes.
We're on fire. Can't you feel it? Can't you guys feel it? We're on fire.
We are on our soapbox.
Girl power.
Girl power. Hey, thanks
you.
a lot for being here. Thank you for being here. Thanks to all of you for joining our Medical Minute. Please like it, share it with your family and friends, and we'll see you again next week, this time on Wednesday, for another edition of Medical Minute. Take care.